Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. Joining us today to really talk about some of their new services and what they're doing as one of the leading outcomes management platforms in the marketplace is Dr. Shaundra Eichstadt with Grand Rounds. Shaundra, good morning.
Good morning. Thanks for having me, Doug. How are you?
We're great, thanks, and thanks for joining us.
Of course.
Give our audience just a brief update. I know we want to talk about some of the new things you're doing, but give our audience a brief update on, Grand Rounds' position in this space.
Oh, sure. Grand Rounds is an outcomes management platform that's really focused on improving the patient's quality of care that they're able to access, and by doing so, we're able to improve their medical outcomes. And there's a few different ways that we can do that. We have a few different services. We have a virtual clinic where patients' cases can be seen remotely via world-class experts. We're able to connect patients with top physicians in their area that are also covered by their particular insurance plan via our office visits. And we're introducing our new in-hospital service to support families as they're going through that critical time when they need the most support. So we have a few different options that we can help patients to ensure that they're really able to access the best care when they need it the most.
Shaundra, this is Brent, and welcome to the program. Give our audience a feel for your background and why you decided to come join Grand Rounds.
Yeah, thanks, Brent. I trained at Stanford, and I really had a benefit of seeing, really cutting-edge medical care being performed there. But also, part of that, I was able to see our patients that were being transferred in from other hospitals or being flown across the country and sometimes across the world were, not receiving that same level of care. And as a physician, that really bothered me, that just because of a patient's geographic location and the physicians and the hospital facilities that were available for them, that they were receiving a very different level of care that really deeply impacted how they did. And, if they survived their cancer or if they had a complication after their surgery, it's deeply unsettling for a physician.
Yeah, so Shaundra, you have a pretty clear value proposition for both the employers, if you can talk about that, and then as you're alluding to, the consumers themselves, the employees and the consumer. Can you kind of highlight, what the value proposition is for both?
Yeah, I think that Grand Rounds offers a really nice service, and it feels really good as a physician to stand behind a service like this because I feel very strongly, and we've proven through the research that we've done at Grand Rounds, that by connecting patients with the proper care at the right time, ensuring that they get the right diagnosis and the proper treatment early in their course, or if they've received improper treatment, if we can redirect them back to that proper course, that number one, most importantly, is that, we can improve that person's outcomes and how that person is able to get back to work and, just all of those health metrics that are really important to them as an individual. But the nice side effect of all of this is that by doing so, we're actually able to decrease healthcare costs. And many employers are seeing that those costs, they're owning those healthcare costs and it's increasingly important part of their budget. And so if we can improve the quality of the care that their employees are able to access, we can actually decrease those costs not only for the employees but also for the employer.
So you're actually addressing quality, accessibility, and cost.
Exactly. I think medicine is one of the few industries where cutting corners is going to cost you much more in the long run. Yeah, go ahead.
Shaundra, is there, we've had the Leapfrog group on the show before, and I've actually sat in some workshops on healthcare transparency, and it's moving, the transparency piece is moving closely to tie itself to hospitals and do a lot of what you're talking about. How do you work closely with the hospital and the employer to make sure that if that wrong course of care, was taken to get it corrected? Is that the relationship that you guys have?
We work directly with the patient, actually. And
okay.
I think that there are different ways that an employer, per se, that's working with us we can look at their patient profiles, their employee profiles and say, we think that the patients most at risk in your population might be those patients undergoing cancer treatment, for example. So we can connect with them and make sure that they are receiving the proper care. But we actually, to me and to our company, patient privacy is very important. So we help patients with their individual personal needs on a one-on-one level, we're able to report back to the company in a de-identified way, so that their employees' privacy, their healthcare, information is protected, but also we're able to provide detailed information back to the employers about the changes that have been made in particular cases in their company.
Hey, Shaundra, for our audience listening, what is your business model? Is it a per employee per month, or what? How do you operate?
It depends upon the size of the company. Mm-hmm. That's generally the offering, and it's depending on what solution makes the most sense for that particular company. Most of our clients do use a per employee per month model.
And does this can fit, I'm assuming, with any size of employer, right? In any
Absolutely.
size. Yeah.
Absolutely. We have large enterprise customers that use us, as well as smaller companies. And I think, employers are really seeing that this is a benefit that as healthcare networks are narrowing and insurance offerings are increasingly more limited, this is a way that they're able to allow their employees' cases to be seen by truly elite physicians without having to pay out-of-network costs out of the employee's pocket.
Mm-hmm. Now, Shaundra, you guys actually recently launched something called office visits. Is that correct?
Mm-hmm. Absolutely.
Yeah, tell us a little bit about that.
Yeah. So office visits help patients and employees identify the best physician within their particular geographic area, and those physicians that will accept the insurance plan, and physicians that are accepting new patients. Those are, all the things that we consider. And we've built a proprietary algorithm that identifies the top physicians in the nation, and it's broken down by geographic area. So let's say if you need an orthopedic surgeon in Topeka, Kansas, we can recommend the top orthopedic surgeon for your particular problem, not just the top orthopedic surgeon, but, for your lower back pain, for example, in the area. And I think that this is really important to me as a doctor, because I think that patients are not equipped to evaluate who the top physician is. You can look to online reviews or ask your neighbors, but I think that unfortunately patients don't have access to the same type of data that we at Grand Rounds have, and that we've been able to go through and look at quality data from a wide variety of things. We can look at patient outcomes. We can look at a physician's training history. We can look at their reputation amongst their peers. And so by conglomerating all of that information, we're able to help patients choose a doctor in a very informed way. We provide them with options that they can feel comfortable and confident knowing that the physician that's provided for them is someone whom they can trust.
Hey, Shaundra, is your database national? Can you help anyone anywhere?
Yes, it is.
Okay, great. Now tell us a little bit about also STAT. That's your hospital program? Is that?
Yes, exactly. Grand Rounds STAT was built upon the premise that, I feel like many of us, when we have a loved one or ourselves are hospitalized, it's really hard to know exactly what's going on. There's so many moving pieces in the hospital, and it's really critical at that time that patients have a full understanding of what's going on and the right decisions are being made. We don't want things to be done in haste without having the proper reasoning evaluated behind them. So patients can use our services to have support during that time. And that's going to mean different things to different families. Some people are going to need support, understanding. They're going to need to talk to a doctor just to understand what is this procedure that my physician is recommending. And others are going to need to understand, do I need to undergo this procedure or should I wait? And so we offer in-hospital support for patients and their families in order to help simplify that time for them.
Yeah, that's very unique, and I think you're correct. I mean, we walk, if we have the unfortunate, challenge to have one of our family members in the hospital, we just many times don't know the right questions to ask.
Exactly. And so it's really helpful to have, a team that's available for patients to help not only tell them the questions that they should ask, but why they're important, to help them digest the answers to that. And, we can provide written materials. It's easy to forget when you're in the stress of that situation in a critical care unit or facing a tough decision with a loved one. So we can really provide a lot of support, which I think is really important, and we can work with the team in the hospital to provide that, because we want to work with them. We're all on the same team here. We're all here working for the same patient. We want to make sure that everyone can understand what's going on as best as possible so that they can come to the best medical outcome.
Now, Shaundra, give on that point, kind of give our audience, these people who are helping the individuals, whether it's at the hospital, whether it's an office visit, what is their expertise? What is their level of knowledge, I don't want to say trustworthiness, but what makes them, what are their credentials that you guys are helping them with?
Absolutely. The physicians that are helping our patients are physicians who are truly leaders in the field. These are luminaries in their respective areas. And, your question about specialties, it would depend upon that patient's particular condition.
Okay.
So a patient who has ulcerative colitis and inflammatory bowel disorder is someone that we would pair with a doctor who specializes in that particular condition as opposed to a physician who treats a different type of bowel disease that actually has a very different process. So we actually match physicians based upon their personal expertise, and they're truly luminaries in their area with the patient's individual condition. It's not that you're just calling and getting a random doctor on the phone.
Right, I got you. That makes perfect sense. Well, very interesting. And we got, Shaundra, we got about a minute left on the program, and want to let you kind of leave the audience with a couple good takeaway points on why they should look at putting in your solution.
Sure. I think healthcare costs are largely driven by a few different things, and those include serious illness, cancer, organ transplants, big surgeries that patients are facing, as well as chronic disease management. And I think that by making sure that our patients and employees are receiving the proper treatment, number one, we feel good about that because we're helping them achieve their best healthcare outcome. But number two, getting the right treatment at the right time really does decrease the cost. And we've shown that every case that comes through Grand Rounds, on average, when you average everything out, saves an employer $10,000, over $10,000. So it's really nice that you can know that you're providing a unique benefit for your employees that will really improve their day-to-day life and their outcomes while also saving your company money. I think there's a few things that can offer that.
Well, thank you, Shaundra, very much for joining us, and very interesting solution you guys got. Hope you have a great long weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Thanks so much for having me. Take care.